The holidays are a time for family, friends, and eating, right? Lots and lots of eating. And that's all cool until you get that painful heartburn or indigestion. So Dr. Navdeep Chehl, a gastroenterologist with Austin Gastroenterology, is here to tell us, first and foremost, Doc, why do people get heartburn and indigestion?
So first of all, heartburn is a burning sensation that occurs in the chest after eating, typically associated with gastroesophageal reflux disease, or what we know as acid reflux. Other symptoms include regurgitation, upper abdominal pain, nausea, belching. These symptoms occur when acidic juices from the stomach come up into the esophagus and cause some injury, and that can occur for a variety of reasons: body weight, smoking, diet, medications, structural abnormalities in the lower esophagus and stomach.
Yeah, all sorts of reasons why this can happen, but there are certain foods that trigger this more than others, right?
Many foods. So let me give you a list, okay? Spicy foods, fatty foods, fried foods, tomatoes, tomato-based products, onions, chocolate, peppermint, and some beverages too: alcohol, coffee, soda. All things that are prevalent in the Western diet.
Everything delicious, particularly the chocolate and the alcohol, can give you the heartburn.
Yes, can. And a lot of these things are consumed frequently around the holiday season, so it's important to watch what you eat.
Okay, but if you just, can't live your holiday life without some chocolate and some peppermint, all the flavors of the season, what are you supposed to do?
So I always tell patients, small changes, big results. So keep your body weight down, don't smoke. It's okay to indulge a little bit, but have some control. Don't overeat. After eating, don't lay down for 2 to 3 hours for a nap or to go to sleep. And sleeping on the left side can help too. If you're on reflux medication, take it daily or twice a day as prescribed by your physician. And if you're having breakthrough symptoms or you're having symptoms for the first time, you need something fast-acting, you can take Gaviscon or Pepcid. Those are over-the-counter, and those are effective.
Yeah. How would someone know, though, if it's something a little more serious other than just heartburn or indigestion?
So what I would say to that is, if you're having heartburn, first of all, if you're having heartburn 2 to 3 times a week consistently, heartburn or other reflux symptoms, you need to see a physician. If you're having difficulty swallowing along with the heartburn, or just difficulty swallowing, feeling like things are getting stuck, you need to see a physician. If you have heartburn and you develop anemia or unintentional weight loss, you need to see a physician. Now, if you're having heartburn here, that can simulate it can be very similar to chest pain from heart issues. Right,
like you think you're having a heart attack.
Yeah, absolutely. And so if you're having chest pain and shortness of breath and lightheadedness, and you have a history of reflux, if you're having any of those other symptoms, you need to be evaluated to make sure it's not a heart problem.
Right. That's not a take a Pepcid. That is go to the emergency room.
Yeah, you absolutely need to be evaluated by a physician.
All right, Doc, thank you so much for joining us this morning with these great tips. We really appreciate it.
Thanks for having me. My pleasure.
Yeah, if you guys missed any of this, you can rewatch this interview on KVUE.com right after the newscast. We'll be right back.